Before you go to bed tonight, make sure you remember to spring forward as we start daylight saving time. The time change can also come with some impacts to your family's health. Now, the good news, it's just temporary. Our Cassandra Garcia spoke with a pediatrician who shares some advice for parents on how to get their kids to best handle the transition.
We all dread losing an hour of sleep, but that doesn't mean we can't avoid the negative impacts that come with daylight saving time. I spoke with a pediatrician that says it's especially important to take these steps if you have children at home. When the clock jumps forward, many of us don't wake up the same.
It's not going to be easy, that's for sure.
I prefer the extra hour.
But there's ways to ease the fatigue.
Exposing to natural light in the morning is very important. And then decreasing your exposure to light at night is very important.
Dr. Celina Moore with the Palm Beach Health Network says it's best to get away from a screen 90 minutes before bed to help you fall asleep easier. As a pediatrician, she stresses the importance of sleep, especially for children.
Getting adequate sleep is vital to brain function and brain health.
It's the reason a lot of people wonder why we're still practicing the century-old time change tradition.
I think changing it's too much.
I think it should be abolished. And honestly, I'm losing an hour on my weekend. I think I should be allowed to go into work an hour late.
A number of lawmakers have unsuccessfully tried to do away with the time change, including Senator Marco Rubio, who tried to change the law in 2022 to remain in daylight saving time. Dr. Moore says the time change impacts all ages. However, children respond slightly differently from adults.
In adults, when we're tired, we get sleepy. Children, on the other hand, have the opposite effect. They almost are being a little bit more hyperactive. With that hyperactivity comes a little bit of irritability. So you've got kids who are throwing temper tantrums.
The good news is it's temporary. Dr. Moore says if you stick to a consistent bedtime schedule and create a routine, the impacts shouldn't last more than a week. Cassandra Garcia, WPTV News.